A deterioration in mental functions, including memory, thinking, and reasoning, is referred to as dementia. Although anybody can experience it, older folks are more likely to do so. Numerous conditions, including Alzheimer's disease, stroke, Parkinson's disease, and brain injuries, can result in dementia. It may have an impact on a person's behavior, mood, everyday activities, and communication, among other areas of their life. Some symptoms of dementia are easily recognized, such memory loss, disorientation, or trouble speaking. However, other symptoms are more subdued and might take a while to manifest. These are referred to be dementia's silent symptoms. The term silent symptoms refers to symptoms that don't clearly bother the sufferer or others close to them. Although they could appear to be typical aging or stress-related changes, they might also be signs of a brain problem and a need for medical intervention. We will be revealing 8 silent dementia signs in this video that you should be aware of. Being aware of these signs can help you identify dementia early on and get assistance or treatment. Making the greatest options for yourself or a loved one can also be aided by early detection. Number 1. Difficulty with complex tasks. This indicates that the individual can struggle with assignments that call for organization, planning, solving problems, or multitasking. For instance, individuals can find it difficult to follow directions, handle their money, or operate a vehicle. The brain regions in charge of executive functions, the mental abilities that assist us in organizing our thoughts, setting priorities, maintaining attention, and restrain our impulses may be injured. Dementia-related decreased attention span or concentration may potentially be the cause of them. Number 2. Loss of smell. This suggests that the individual could have trouble identifying familiar smells or smelling objects. They might not detect smells, deterioration, or burning, for instance. Damage to the brain regions linked to the olfactory system may be the source of this symptom. The sensory system that enables us to smell objects and connect them to feelings and memories is called the olfactory system. Remember that allergies, illnesses, age, and nasal congestion can also cause a person to lose their sense of smell. Number 3. Language difficulties. This indicates that the individual can struggle to find the right words, comprehend what other people are saying, or effectively communicate themselves. For instance, they could speak incoherently or vaguely, repeat themselves, or use the incorrect term. Damage to the brain regions involved in language production and comprehension may be the source of these issues. They may also be the outcome of dementia-related memory or attention deficits. Number 4. Changes in sleep patterns. This suggests that the individual can experience difficulties going to sleep, remaining asleep, or waking up. Additionally, they could notice shifts in their sleep pattern, such as sleeping longer during the day and shorter at night. They could also have frightening or vivid dreams. Damage to the brain regions responsible for controlling sleep and circadian rhythms may be the source of these alterations. They may also be brought on by pain, worry, sadness, or adverse drug reactions from dementia or other illnesses. Number 5. Changes in personality or mood. This implies that the individual can behave in a different way or experience abrupt emotional changes. They could, for instance, become more agitated, nervous, melancholy, or indifferent. They could also grow less interested in activities they formerly enjoyed or retreat more from social interactions. Damage to the brain regions in charge of mood and personality may be the source of these alterations. They may also be brought on by anxiety, dissatisfaction, or confusion brought on by memory loss or other cognitive issues. Number 6. Changes in appetite or taste. This might indicate that the individual has distinct tastes in food and beverages, or that they consume more or less than normal. For instance, they can have a need for spicy, salty, or sweet meals. They could also completely lose interest in food or neglect to eat. Damage to the brain regions that regulate appetite and satiety may be the source of these alterations. They may also be the consequence of mood, taste, smell, or medicine side effects brought on by dementia or other illnesses. Number 7. Trouble with spatial awareness. This suggests that the individual can struggle to judge sizes, forms, directions, or distances. For instance, individuals could trip over objects, become disoriented quickly, or struggle to understand graphs or maps. Damage to the brain regions responsible for processing spatial connections and visual information may be the source of these issues. They may also be the consequence of age-related or other conditions-related visual or hearing impairment. Number 8. Lack of insight. This implies that the individual could not be aware of their dementia or the deterioration in their skills. They could also downplay or ignore their issues, or they might put the blame elsewhere. For instance, they might maintain that everything is okay, they don't need assistance, or someone else is stealing their belongings. Damage to the brain regions responsible for reality checking and self-awareness may be the source of this symptom. It may also stem from fear, shame, or dementia-related denial. What should you do now if you have these symptoms? Don't overlook or write off these quiet dementia signs as a natural part of aging if you observe them in yourself or someone you care about. These can indicate a serious illness that requires diagnosis and treatment. Speak with your doctor and obtain a complete evaluation as the first step. Your symptoms, everyday activities, and medical history will all be questioned by your doctor. Additionally, they will provide tests to evaluate your language, memory, and other cognitive abilities. In order to rule out other potential reasons of your symptoms, they could also perform certain blood tests, brain scans, or other examinations. Obtaining a diagnosis and a treatment plan is the second stage. Your doctor may recommend certain drugs, treatments, or lifestyle modifications to help you manage your dementia and enhance your quality of life, depending on the kind and cause of your illness. In order to give you more specific treatment and assistance, they could also recommend that you see experts like neurologists, psychiatrists, psychologists, or geriatricians. Ultimately, keep in mind that dementia is not fatal. Millions of individuals worldwide suffer with this illness, which is manageable with the right support and treatment. You may improve the quality of your own and your loved ones' lives by being aware of the silent signs of dementia and getting treatment as soon as possible.